All right, so last week, if you're tuning in today and you didn't come in last week, Dr. Jordan and I are doing these weekly chats. I'm kind of talking about OsteoStrong overall, and Dr. Jordan is talking about our overall health and improvements that we can do daily to help improve our daily life. So last week I spoke a little bit about OsteoStrong as a whole, how it works, and how we have the biocharger, how it can help our immune system, especially right now in this time that's what we're all trying to do, is keep our immune system strong. So today I thought I would just briefly go over a few questions that we get often. And so I hope these answer. If you have these questions, I hope that answers them. And again, type your question in the chat box or ask at the end. So one question we get very often is, how is OsteoStrong different from just lifting weights at the gym? And it's different because lifting weights causes exhaustion, which causes the central nervous system is triggering an adaptation to hold more fuel, which is why when you're doing a bunch of push-ups or really lifting weights or anything, your muscles feel really tight. Where at OsteoStrong is causing kinetic fatigue instead of fuel fatigue, which is engaging the muscles to their fullest degree, similar to a real life situation. For example, if in case you fall, you're engaging every single muscle, tendon, bone, and ligament. All of that is all optimized. So that's how, in a little nutshell, how it's different from just going to the gym. And also, at OsteoStrong, we're setting you up to be in your strongest position where you're able to exert 4.2 times your body weight, which for many people can be really hard to go, do at the gym. For example, if you weigh a little over 100 pounds, it's not that easy for everybody to just go to the gym and go do a leg press or lift up over 400 pounds. So that's a little how it's different from a gym. Last week, someone asked if they can still work out and do OsteoStrong at the same time. Yes, that's something that we do recommend, that you do whatever exercise it is that you like outside of an OsteoStrong session, because they do complement each other and you can see some improvements in both. OsteoStrong can help make you stronger in your exercise, and your exercise can help make you stronger at OsteoStrong. However, we do not recommend that you do an exercise right before your OsteoStrong session, just because taking it back to the fuel fatigue, we don't want you to come in so tired or exhausted, your muscles are exhausted, therefore you're not giving OsteoStrong your full capacity. OsteoStrong sessions are done once a week, and it's done once a week because our bones grow very slowly. So you need to give them that time to recover. Again, because we are trying to do 4.2 times your body weight, especially in the our lower growth trigger for your hips, where you want to see a big improvement. We want to give your body that amount of time to recover and regroup. It was shown when they were developing OsteoStrong in the studies that those that were doing it multiple times a week, as many people do a gym, they were actually seeing slower improvements versus coming once a week and allowing their bodies to have that recovery time. Also, a question that we get sometimes is, can you do OsteoStrong if you've had a knee or hip replacement? That answer is also yes, because OsteoStrong is strengthening our bones, and particularly to this case, we're strengthening the bone surrounding the replacement, which is known as the trabecular bone, that enables it to grip the replacement more effectively. For the same reason, it's a good preconditioning to having that surgery, because then the surgeon also will have an easier time getting the replacement to hold to the bone better. Lastly, before I hand it off to Dr. Jordan, one question we get is often, how long does it take before you see results? And there's a variety of results that you can see from OsteoStrong, more than just seeing an improvement in your DEXA scan. But again, everybody is different. So these results that I'm gonna share with you are over time through a variety of our members, but again, it all goes back to your own body and what you do to it, how you treat it, and what you're doing outside of OsteoStrong. A lot of our results that we see are joint and back pain. This has been a big one where many members have seen improvements anywhere from 1 to 4 months. While someone can have pain stemming from a bone-on-bone condition where they may not have any cartilage left, that person may always kind of have some pain around it, but OsteoStrong can help strengthen the tendons and ligaments surrounding that joint, which will cause the joint pain to separate and over time will relieve some of that pain. Seeing improvements in their bone density. Obviously, that's what we all want to do. We want your bone density to increase. We all want to see those improvements in your DEXA scans. As far as the DEXA scans, again, because our bones grow very slow, that can take anywhere from 12 to 18 months to see a good, significant improvement in your DEXA scan. We do also work to improve balance. Again, like I talked about last week, we start on the vibe plate, you do your spectrum, and then we go back on the vibe plate. Balance improvements can happen anywhere in as little as 1 to 2 sessions where you may see some improvements in your balance. Muscular strength, again, we're working on improving our skeletal system, which helps make the muscles stronger. And you can see that overall sense of strength, again, in as little as a month. And posture, because we're a session coach is always with you. We are always making sure that you are in your proper position, your back is nice and straight, you are not hunched over, all of that we're taking into account. Many members see improvements between 5 to 15 sessions of doing OsteoStrong. So I want to leave enough time for Dr. Jordan to get her part in, but like I said, these are some common questions that we get at OsteoStrong, so I wanted to cover them here so you can share, or maybe it's a question that you wanted to. Someone asked if their bones are depleting while they are not doing OsteoStrong right now. And the answer to that is no. There is some people do take breaks between sessions. You can miss like up to 2-3 weeks, but people that have taken longer breaks even before that, that recovery time is a long time, and sometimes it can take up to 120 days. So your bones are still growing, your bones are not depleting by no means, and we have not been closed, longer than 2 months. So right now you are still good, and we are opening soon. All right, so I'm going to pass it over now to Dr. Jordan, and I'm excited to see what you have to say today.
Awesome. So for those of you that don't know, that haven't seen our previous 2 segments, I am Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, which is a state-of-the-art wellness clinic in the northern Chicago suburbs. And Demi and I have partnered up to offer all of these educational programs because we have very complementary businesses, and our goal is to improve the health of all of our clients. So if we can do that through education, especially while the stay-at-home order is in place and you're able to make some modifiable changes, please utilize us as resources. If there's questions that come up after this, or if you're watching, obviously, the video and replay, you can always feel free to reach out, and Demi can connect us, or you can contact our office directly at info@drleasure.com. But I wanted to talk today a little bit about the difference between common and normal. And I think especially, not to make a sweeping generalization here, but as we age, unfortunately, the incidence of disease processes increase. And I hear oftentimes in my patients, well, I'm X age and that's to be expected, or my parents had XYZ disease, my parent or my sibling passed away from XYZ disease, and that's just essentially my destiny. And I would like to put my foot firmly down right now and go on the record saying there is a very large difference between common and normal. And you have the power, all of you sitting at home right now watching us, to control your destiny. your genes are not your destiny. Your behaviors and your lifestyle choices will determine the path that your health will take. Documents and studies show that over 85% of disease is based on lifestyle choices. And now, just like if you have or have not learned in your OsteoStrong classes, your bones will change based on the forces that are placed on them. So yes, unfortunately, if you sit at home and you do absolutely nothing for the next 5 years of your life, you are going to see a decrease in bone mass. On the opposite, if you are proactive and you are engaging in a structured program like they offer, you will see the opposite, where you will actually regain and you will grow bone. And I think that that needs to be remembered because it goes for every aspect of your life. If you are being proactive in your dietary choices, unfortunately, and myself included, my mom bought me a Peloton last week. I've done 10 rides. And even with the overwhelming amount of education that is spewing out of my brain, I hop on the scale after 10 rides and I'm expecting that baby to drop. And I think that, we need to remember that every single choice we make is cumulative, and we need to be making little choices every day that are moving the needle in the right direction. You don't need to be foolproof. My recommendation for my patients is always 80-20. If you're able to make the right choice 80% of the time, and that goes for your activity, it goes for healthy mood, and it goes for healthy eating habits, then you'll be trending in the right direction. So, as far as common and normal, and especially in this age group, I don't want to get into too many specifics and take up too much time, but arthritis is very common, and arthritis is an inflammatory condition. Unfortunately, again, a lot of my patients will come into my office and say, well, my doctor said I have arthritis, and it's sort of treated like a cancer diagnosis, like they have X number of days to live and their joints are never going to be the same. And I will tell you, counter to that, if you are able to decrease your inflammation, if you're able to get joints moving, like Demi had mentioned before, moving in a stronger fashion, biomechanically the way that they should, then you will absolutely decrease that incidence of arthritis. You will decrease your inflammation, and you will decrease pain. And not to counter what was said earlier, but even those clients that you guys have that are strictly bone on bone, the fact of being bone on bone is not what causes pain. It's the inflammation in that area. So if any of you watching have had that bone on bone diagnosis, don't let that discourage you from your OsteoStrong workouts and having very positive results, because if you're engaging in decreasing your inflammation while you're doing those activities, even if you continue to be bone on bone, your pain levels will decrease. And I think that, we need that motivation, and clients need that education to understand that there is a light at the end of the tunnel. Don't feel like because someone's given you the diagnosis of arthritis that it's all downhill, because it's not. You can engage in activities that you love. You can regain your strength. You can continue to be active. You just have to maybe be a little bit more proactive in your actions to get that inflammation down. And heart disease is another one that is very common, and not to play down the seriousness of heart disease, whether it is a heart issue, previous strokes, TIAs, things like that. But also, if you are being proactive and you're taking your fish oil at the right doses, again, any recommendations that I make, please make sure that you run them past your physician prior to starting or stopping any supplement regimen. But high dose fish oil has been shown to improve some of these conditions. Taking I want to say cartilage, taking collagen has been shown to strengthen cartilage. So whether it's the cartilage in your joints or strengthen your blood vessels, that may be something that can be beneficial, so that you don't have to continue down that downward road of heart disease. And cancer was number 3 on my list as being very common, but it doesn't have to be normal. And site-specific cancers are, that stat that I gave earlier about 85% of lifestyle choices being correlated to disease. And site-specific cancers are actually higher than that. They show that lifestyle choices contribute to somewhere around 90% of site-specific cancers. So again, if you're able to improve your lifestyle choices, no matter what your age, you can decrease your incidences of these diseases. And especially being important right now, the one I wanted to end on was respiratory illnesses. So if you find that you are having, or if you have experienced, COPD, asthma, chronic bronchitis, emphysema, if you have been more vulnerable to pneumonia, you want to make sure that you're being very proactive these days in strengthening the lungs so that you're not succumbing to, the viruses that are around right now that we're working on trying to stay healthy from. So as always, the name of our office is Proactive Health for a reason. We hope that all of our clients are taking small bites every single day of positive health choices. And please remember that, the 1 day a week that you're spending with me, you need to spend those other days really working on decreasing inflammation so that your time spent with them will be that much more productive. So if there's any questions that come up, we wanted to save a little bit of time so that we could hit those, because I think we had a lot of questions last week. So feel free. I didn't really dive into anything too specifically this week, but next week we're really going to talk about meal planning and food. So I hope that you'll join us for that one.
I love that topic of food. I like what you were saying today. If I can share like an example of like how I remembered what you said when I first heard it. This is how I first heard it as like, these are telomeres as like chromosomes in our DNA of what you're saying. We have the ability through our lifestyle to expand and shorten it. So I heard it as like think of it as like a shoelace, like that shoelace plastic that's at the tip. You have the power to, through your lifestyle, to either extend it or shorten it. So stuck with me.
That's awesome.
Sticks with anybody else.
Yeah, that's a great way to think of aging. And then when I'm teaching on epigenetics, which is the expression of the individual genes, it's sort of like your sleeve. So your arm, we each have different genes. So you may have the gene for heart disease or for cancer or for diabetes. But if you're working out and you're eating well and you're managing your stress, you're rolling your sleeve down. So you're not going to express that gene. But on the flip side, if you're eating a whole bunch of junk and you're very high stressed and you're not having proper movement patterns, essentially what you're doing is you're rolling your sleeves up and you're saying, come get me, to disease. And, hopefully through education, all of our patients have their sleeves all the way down and really long shoelaces.
Someone saying, if you have any thoughts on alkaline water.
You know what? I go back and forth. I don't like everything. I don't have the time to research all of it. I've seen benefits, and I can't remember the Kangen, I think, is who I used to have at my house. And, I kind of use myself as a guinea pig, and I didn't see any considerable changes in my blood work, in my energy, and in any of that stuff to speak to it creating a marked improvement, but that doesn't mean that it's not beneficial. I had the benefit of doing a lot of other positive things at the same time, eating clean, working out, managing stress, things like that. So for an individual that maybe isn't doing everything else positive, drinking the water may have a more marked improvement. I don't think it's bad.
Yeah, I drink it a lot. I know it's good because it's just a higher pH, like it's less acidic than what you would get often. And I'm a big coffee drinker, and I know coffee's pretty acidic, but if it makes it any better, I do use alkaline water in my thing to help make it less acidic. Trying to cancel it out there as much as I can.
I like that.
All right. Feel free to type in the box, or you can unmute yourself if you want to ask any questions. Should we come ready next week with paper and pen for a grocery list?
No, actually, that's too much work, and I don't like too much work. What I'm going to do is I'm going to put together actually a free 5-day meal plan for everybody that is anti-inflammatory. So I'm going to have Demi email out It's going to be a shopping list, recipes, and a meal plan, so you know what to cook when. So you literally don't have to write anything down. You just have to listen and enjoy our banter.
I see someone unmuted themselves, so feel free to ask your question. Do you have a question, Pat?
Not at this time.
Okay. Someone that is just iPhone. Did you have a question if you unmuted yourself? No? Okay. We have a question from Barbara. Have been taking orthobiotic for probiotic. Is this okay?
So I can't speak to anything specific since we don't have an established doctor-patient relationship, but I can tell you that things that you should look for when you're taking your probiotics is they should either be refrigerated or they should be in a blister pop pack. If they're not, if they're just in a, in a container, and I'm sitting at my desk, you think I'd have. So if they're just in a container like of vitamins, then they're going to be dead bacteria. So it doesn't mean that they're worthless, but it's not what I would recommend to clients. I like to make sure that everybody's getting, the most bang for their buck, and probiotics, high quality probiotics, are not cheap. So, I always recommend that they're either refrigerated or they're in a blister pop pack.
And speaking of probiotics, I recently heard from someone that it's good to change your probiotics every 3 months to like find some that you like and alternate. How do you feel about that?
It depends. I hear that, and the research doesn't necessarily speak to that. I think that's more of a marketing idea that somebody came up with. We're routinely killing off our bacteria. So it's not like the bacteria that you are attempting to colonize with your probiotic is sticking with you, because, and I think you and I talked about this before, but if you're drinking alcohol, if you're under high stress, if you're eating processed foods, sugar, all of that stuff is going to kill the good bacteria. That's why we have to recolonize over and over. But unless you're taking something for a specific manner, like recolonizing vaginal bacteria, that's not something that you need to be doing, indefinitely. Or if you're taking, for instance, probiotics after antibiotics, you should be taking a specific strain in order to help recolonize everything that was killed from the antibiotic, and then you can get back on, the probiotics that you like, that serve you well.
Follow-up question from Barbara. Do you have any suggestions on where to get the refrigerated ones?
My office, where are you? But in all honesty, I tell patients to be very careful. So ideally getting them from your physician. So unfortunately, and I don't like to name names, but there is a store that I used to love that sells a lot of organic stuff that was recently purchased by an online retailer, and they, in my personal opinion, the quality of the products that they carry across the board, not necessarily just supplementation, has gone downhill. If you're buying from a provider, then you know for sure that it was shipped. So it was stored in a refrigerated container. It was shipped refrigerated. So when I receive probiotics, they're shipped with an ice pack, and they're cold, and they immediately go in the fridge. In a big box store, I don't know that you can guarantee that. And unfortunately, if you're ordering online, the warehouses, of some of these big box stores, the warehouses themselves can get up to like 120 degrees. So they're probably killing the probiotic before it even gets to you. So that's why, I would recommend buying from a local physician if you can.
Right. And next one from Barbara. Do you know about Walsh in Evanston?
What is it? Is it a doctor's office? Hop on and chat with us.
You can unmute yourself, Barbara. I miss talking to you.
Okay.
Probiotics. Here, can you see this? This is my.
We have a question
kombucha
about that coming up.
Yeah. It's just a private drugstore sort of health. It's natural health stuff. And you
Okay,
can
so
get all sorts of supplements, vitamins, whatever in there. I've
I'm
never
Googling.
asked about the refrigerated probiotics, so I
Yeah.
don't.
I'm Googling, so I will look while we're talking. You know what? I'm not familiar with them personally. I would take a look at, you know, the reason I recommend is a provider is because they're going to be able to look at you as a whole and make recommendations specific
Right.
to your needs, as opposed to some of these smaller stores, which are great, you know, and they educate themselves, but a lot of times they're also educated by their retailers. So these aren't necessarily individuals that have a medical background. They may know the benefits of the products really well, but they
Right.
won't necessarily know, you know, the biochemistry of if it's going to interact with something else you're taking, or if it's the right need, you know, if it meets your individual needs. That's my only hesitation.
Okay. Are you seeing new patients?
We are seeing new patients.
Get in there, Barbara.
Okay.
Come see us.
Right, we have a question from, I believe it's Elsbieta. How about eating yogurt with live cultures or fermented foods?
No and yes. So this is my newest obsession. I feel like I should be doing, I run a stress management boot camp on Facebook, and I've been doing a live video every single day since this started. And I've been drinking so much of this, I feel like I should be making a commission. But it's amazing. This is Health Aid Kombucha. So both kombucha and yogurt are going to have sugar. So you don't want to do either in extreme amounts, because again, sugar is going to be killing your good bacteria. Dairy itself is very inflammatory. I don't think anyone should be doing dairy for any purpose. I like dairy alternatives. So if you're eating yogurt because you like the taste of it and you're doing it infrequently, then I would say it's okay. But count that as your 20% naughty time. I would not consider eating yogurt a healthy choice. So don't think that you're doing it and being, again, one of those proactive options, because it is going to be inflammatory. So even if it has live cultures, the negative is going to outweigh the positive. You know, if you do, my one caveat to that is like high quality kefir. If you're doing high quality kefir once in a while, same thing, that's okay. And the same with kombucha. I don't drink anything but water. And I've been probably doing more of this than I should, but because the added sugar is more than I would like. But moderation, that's the key.
And if you want to try a non-dairy yogurt, I like Kite Hill, if you like it.
Yeah.
So speaking on to kombucha, Alice is asking, is there a certain time of day to drink kombucha? And do kombucha drinks on the market all have a similar effect?
So no, I would say probably not. If you can make kombucha at home, which I have not done, but according to all of my friends, it's easy once you get it set up. I'm hoping to do it, but you know, it's just like anything else. You want to be an educated consumer. So you want to pay attention to the ingredients. You want to do your research, you know, background. Referrals from friends is the best thing. Trusted recommendations. I am a fan of this. This is Health Aid. There's a few others that I've done. There's a local brewery, Kombucha, I think it's called. They're out of Chicago, and they actually I hosted a women's retreat last October, and they were one of our sponsors, and it was awesome. You know, I think we would like, just as a race, we are really wanting that sweetness in our beverages. And I like that a lot of these are more on the tart side, that they have that like vinegar kick to them. And then as far as timing, I wouldn't think so. I haven't seen anything like that in the research. For me, especially during this quarantine, you know, I'm being very proactive in not having alcohol. So I'm actually, you know, I've done this first thing in the morning, and I'm drinking it at home in my champagne flutes. just to make myself feel a little more special. So I do this literally like in the morning, like I'm having brunch. I do it like champagne. You know, I've done it in the evenings. So if there is a specific time, I haven't seen it. I think whatever time is good for you.
All right, we have a few minutes left, and there is a question. How do you feel about bone broth?
Mm. Yes, that's a 100% yes, whoever asked that. You can make your own. It is very easy. That's one that I do routinely. If possible, make sure that you're getting obviously high quality bones to start, but it's literally like making stock. So I usually have done chicken, so I'll put a chicken carcass in, and when I cook, will save my leftover vegetables or stuff that isn't like really pretty to eat. So I'll save like the ends of carrots, the ends of celery and whatnot. When I'm ready to make my bone broth, I'll throw that all in, fill it up with filtered water, add in my apple cider vinegar, put in spices, you know, a few bay leaves, literally like you're making stock. Bring it to a boil and then bring it down and let it simmer for almost like the rest of the day. Usually what I'll do is I'll bring it to a boil and then I'll put it in a crock pot on high and I'll let it sit in the crock pot overnight. And then I'll strain it in the morning. And for me, what I do, I have a toddler, so I like to give it to him as well. But I'll put it in, I think this little container I have was originally for baby food, but each well is a quarter of a cup. And so I'll fill up the wells and I'll freeze it. So then if I am cooking and something requires broth, I'll utilize that. And then I know that each little ice cube is a quarter of a cup. Or if my son or I are going to drink it, then I'll usually defrost, you know, just let it warm up and drink it like tea, you know, or drink it like broth. And depending if I'm have 2 seconds to relax, I'll enjoy it. And if not, you know, it's kind of like a shot and you're on your way. So it's amazing. It's very beneficial. It's great for the quality of skin. It boosts collagen. It is great for the joints. It's very healing for the gut. So definitely that's one I would put in the yes. Check that off. Yes category.
Oops. Do you have a preference between beef, pork, or chicken broth?
Not really. It depends on, you know, remember usually speaking, the bigger the animal, the more toxins they're going to hold. So if it's something that, you know, that you're doing at home, if you can mix it up, or if this is something you're buying, you know, obviously trying to get grass-fed beef, or if this is pork that you're purchasing, you know, heritage pork, the best quality raw materials is what you want to make sure you're starting with.
And I think that goes with any food, period. High quality, good food.
Absolutely.
All right. I think that just about sums it up for today. This was a good one. I like all the questions that come in.
It's awesome.
All right. So we'll be back here next week, same time.
Sounds good. Everybody have a wonderful week.
All right. Thank you, everybody. Have a good week.